and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hello, South Florida and beyond, and welcome to the You and Your Doctor's Show, I'm going to call it tonight, because we have two great physicians in the studio tonight. We're going to start with Dr. Jgar Shah for the first segment. He's a rheumatologist, and we're going to get into all the info about him. And then the second segment, stay tuned, because we're having Dr. Monica Shah, hospital medicine, on. So, Dr. Jgar Shah, let's start it right out. Welcome to the program. How are you doing this evening?
I appreciate it. I love this late time slot. It beats a lot of the traffic. It's a good way to come home and have the kids will already be asleep by now.
Thank you for joining us on this adventure of health, and we're so lucky to have you. I know you have two little ones at home, so I'm just happy to have you in studio. And I want to congratulate you first and foremost on your most recent award. That's great. Congratulations. Please tell me a little bit about it.
Thank you foremost. It was a really special award. It was in our second year in practice. It was presented from the Arthritis Foundation as the Rheumatologist of the Year award for 2019. The ceremony was amazing. It was held down near Miami. All my family, friends were there. The entire office was there. We even had some of our patients show up, so it was pretty special being able to thank everybody in the audience and really appreciate everybody that's not just going into becoming an award like that. Everybody's supporting each other, trying to get to that.
Yeah, and that is a great accomplishment, like you said, in your second year of practice down here. I know you're building a great practice, for the community and rheumatology and healthcare in general. Tell me a little bit about the Arthritis Foundation.
So the Arthritis Foundation, the reason why I thought the award was extra special for me, it's a complete nonprofit organization, and their sole purpose is just for an education and kind of guidance for patients that deal with any type of autoimmune arthritic condition. They have small groups that meet on a monthly basis, and they're basically just to educate the community on what they can do with arthritis, what they can eat for arthritis patients, but also knowing for those patients that they're also a support mechanism. You're not the only one living with this arthritis. Tons of people in the community have arthritis, and not making you feel like you're just in this disease by yourself.
Yeah, and that's great outreach that they do as well. And like you said, there's a lot of different, elements that go into, disease management and, having that outreach and letting the community, I shouldn't say, know about the pertinent information is a great thing.
Exactly.
That's really great. Rheumatology, I asked you this last time. I've learned a little bit more since then. It's not a topic or I don't have a lot of rheumatologists in that chair. So can you again tell us a little bit about the medical specialty of rheumatology?
So I get the same question even from some family and friends, like, you're a rheumatologist? What does that mean? So rheumatology, word itself means you're the study of arthritis. So it's not just the arthritis that we see. We also see all types of autoimmune diseases. To me, a rheumatologist, I'm a big football fan, I'm sure you know, is kind of like that quarterback. So when a neurologist isn't sure what's going on, or an infectious disease doctor is not sure what's going on, or an orthopedic surgeon's not sure what's going on. It's kind of that rheumatologist that puts all these pieces together, and it's kind of, that's the reason I love the field. It's kind of exactly like a puzzle, try and put all the pieces together, get to the right diagnosis, and then go over treatment options with patients. And it's for patients, we see patients as young as 18 years in our office, and our current oldest patient is currently at 95 years old. So we have a vast age range in our office.
And I'm glad you made the analogy of the quarterback. I was hoping you were going to do that, and it's so timely with, we just had Mahomes and Garoppolo just the other night, so quite a quarterback duel. So that is a great analogy of explaining it. We have a huge baby boomer population here in South Florida. Obviously, people come here to retire. It's a great area, people from all over the world, etc. How can you help that population? Because I know they're aging, and they have a special set of needs as well. So how do you help them?
So it's important to know that actually most of the autoimmune diseases usually happen right around that 40-year-old age range anyway. So actually those are the patients that we really want to try and catch their autoimmune diseases at an early stage. Those are patients that usually are going from doctor to doctor, and they're just not getting an answer on their symptoms. And so that's the population that we usually see that have just struggled with their symptoms and not just gotten to the diagnosis. So we usually see a lot of the baby boomer population. But again, being in South Florida, you're going to get a heavy majority of a lot of senior citizens and the elderly population. And not just about their arthritis, we really try to concentrate them on the well-being, make sure they have decrease in fall risks and so forth like that. We usually do a lot of osteoporosis screening, make sure they have good bone health, they're taking a good amount of vitamin D and calcium and so forth like that, and to prevent them from having fractures and winding up in the hospital and so forth like that. So again, we not just the baby boomers with autoimmune disease, and we see a lot of patients with golfer's elbows, tennis elbow as well, but we also see a lot more complex diseases in that population as well.
Well, definitely, it's great to have a rheumatologist in your book there, that your book of information. I was thinking of Rolodex. I was like, what? Haven't said that word in a while.
They don't have them anymore.
Yeah. Actually, some offices have them, but I know your office is high tech, so definitely you have the electronic versions of that. It's Dr. Jgar Shah, Arthritis and Rheumatology Center of South Florida, 5901 Colonial Drive, Suite 303 in Margate. Great building, great office staff, great practice that you've built there, and it's something to see. It is a brand new building, correct?
Yeah, so it's a brand. The building's been there for a few years, but it's a brand new office. We redid everything in the office. It's completely new. Repainted everything, redid the flooring, broke down some walls in the office. I try to make the office as modern as possible. Even the check-in part of the thing, it's now iPad driven. So you put everything on iPad. You don't even have to fill out a paper. We're trying to make everything paperless and seamless. A little bit resistance from the elderly population on why there's so much technology going on. But I really think that's what we're gearing towards more. And so we really want to be the forefront in that, in the medical community, to be offering that to patients.
That's great. And again, it's Arthritis and Rheumatology Center of South Florida. It's in Margate, 954-281-8891. The website is floridaroomcenter.com. So Florida, RHEUM center.com, or you can email them at frontdesk@floridaroomcenter.com as well. I always like going into doctors' offices when they're new and they're clean and they're efficient. I always look for that. As I'm getting older, I'm going to the doctor more, but I always look for that. It just really eases the patient. It really does.
Yeah, and we've been really conscious with our front desk and making sure we need to honor the patient's time. Patients that wait. If you're having a patient wait in the waiting room more than 30 minutes, they're not going to be happy coming in and seeing you. So we're really trying to minimize those wait times if we have to move patients around a little bit. We just want to make sure that patients aren't sitting there waiting for their appointment getting called into the back. So we really want to be in the forefront of trying to make those wait times as small as possible as we can do it.
Well, we got about 2 minutes till the break, so I'm going to kind of go in a speed round.
There we go.
You do musculoskeletal ultrasounds in office?
Yes. So every one of our injections, whether it's a cartilage injection or a steroid injection for rotator cuffs or a bad knee or a bad elbow, we have an on-staff ultrasound sonographer who's certified and MSK trained. So the benefit is we can not just do diagnostic ultrasounds and decide if somebody has a tear or a partial tear, but we also can show the patient himself while we're giving them the injection where exactly the medicine is going.
That is outstanding. That really is. That helps with being comfortable in the office.
Yeah, it makes all the patients more comfortable seeing it. Look, this is where your medicine's going. Here's the screen and what it looks like.
And then I'll get to a couple more. Osteoarthritis, so that's wear and tear arthritis. So that's pretty common.
So a lot of our patients, again, in South Florida, we do get a lot of wear and tear arthritis. So we really try to make sure it's a lot about diet, a lot about co-management, a lot about load management, and you hear that again a lot in sports as well, is making sure you're not just putting too much wear and tear on each individual joint.
I'll mention this one because my listeners have to know this by now. Platelet-rich plasma therapy. They've heard me mess that up many times. PRP injections.
So PRP injections are obviously one of the new state-of-the-art things. They're basically taking the patient's own concentration of platelets, spinning it down via centrifuge, injecting them into the tendons and ligaments. And it's a lot more, not just for pain, but also for healing. And that's why it's one of the best things out there in the market.
Okay, last two. IV biologic medications.
Okay.
Those are available there as well.
So
right in the doctor's office.
Yeah, so right in our office, we have an infusion suite, fully furnished with leather chairs, Netflix on the TVs. Everyone has their own tablets, free Wi-Fi. A lot of our medications for rheumatoid arthritis or psoriatic arthritis do require IV biologic therapy. We also offer as well IV vitamin therapy for some of our healthier patients for their better hair, better nails, and so forth like that. So we are trying to go into as many things as we can in the office.
And then lastly, that all combines, vitamins are so important. The Oasis Health vitamin supplements are...
So the Oasis Health vitamins that we do offer in our office, we've seen a lot of patients that say, I buy turmeric from here, I buy glucosamine from here, or fish oil from Walmart, and so forth like that. So we really partnered with this company called Oasis, and it's only made by physicians. It's actually physicians that are formulated. It's gluten-free, GMO-free, and we've tested it with many third-party sites so that you're getting the exact dose that you need, and everything's completely on the label. So you're not getting some artificial thing of any kind of things. There's medications there for sleep, for memory, for inflammation, for your bones, and all kinds of osteoarthritis even symptoms.
Well, I really like that. I'm going to come by just for that. Hopefully I don't have to see you very soon for my arthritis, but that is really cool that, it's physician-made and you offer it right there. Lastly, I'll just mention... Dr. Shah's office does Wednesday nights appointments till 7 p.m.
Yeah, so trying to stay ahead of the curve and trying to make it as easy for people like yourself that's constantly working. We really want to make sure those people that are having those 9-to-5 jobs, if they can't come out at work and don't want to call out sick and so forth like that, we open up that Wednesdays from 5 to 7 p.m. to see those patients.
And still doing Saturday mornings,
We're still doing Saturday mornings. I'm not sure if the staff loves it as much as I do, but it's only from 9 a.m. to 12 p.m. by appointments only. But again, a lot of patients appreciate, obviously, less traffic on the roads and so forth like that. So those patients that are so busy during the week, they can't make it in, we do have that opening for them on Saturday mornings as well. Well, that's
outstanding. Take advantage of that, South Florida, because you don't see that very often. I haven't mentioned that very often on this show. Well, I want to thank you so much for
I appreciate it.
info.
I appreciate you bringing back on the show. I mean, it's always a good time. I can't wait for the next guest.
Yeah, that's going to be interesting. We don't have a lot of hospitalists on here, hospital medicine. This will be great. So, again, it's Dr. Jgar Shah, Arthritis and Rheumatology Center, South Florida, 5901 Colonial Drive, Suite 303 in Margate, 954-281-8891, or FloridaRheumCenter.com. That's Florida, RHEUM Center.com. Thank you again, and stay tuned for Dr. Monica Shaw. We'll be right back on the You and Your Doctors show.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027, or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. Patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Hello, South Florida and beyond, and welcome back to the You and Your Doctor Living a Longer and Healthier Life show. You and Your Doctors, because we had two doctors on tonight, 2 for 1. That's great. We're here with Dr. Monica Shah, hospitalist, hospital medicine, Broward Health Imperial Point, and Broward Health Coral Springs. Dr. Shah, welcome to the program.
Thank you so much for having me.
Thank you for joining us on this adventure of health, because I don't think in 4 years of doing this I've had a hospitalist in that chair, so I'm really excited to learn about this. So what is a hospitalist? Let's get right to it.
Yeah, let's get right to it. So we get that a lot. You know, a lot of patients of mine are like, you're seeing me? Hospice? What? And it's not hospice at all. It's a clear distinction. So hospitalists are a team of physicians that are board certified in internal medicine or family medicine. And we're specialized in patients that are hospitalized, so very acutely sick patients that require hospitalizations. That's who we treat.
Yeah, I actually Googled it today because that's the first thing we do nowadays. You know, you hear that from everyone.
Oh, yeah, everyone.
And it actually, I was seeing, what were some of the most common reasons. And hospitalists, that is a very important role in the hospital because it's kind of like after people come through the ER and once they're admitted, they're assigned hospitalists in most cases, right?
Exactly, that's right. That's the role of the hospitalist physician, is to see you from the ER admission all the way up until discharge. So we take place of that primary care physician that's not always able to come in the hospital setting and see the patients as your primary doctor.
And just so everyone knows, hospitalists like yourself are just on staff at the hospital. You don't see patients outside of them. You just see when they're in the hospital.
Exactly. Just in the hospital because you need that, for acute care patients that have, doctors right on site and are able to coordinate, care with the nurses, case managers, physical therapists, and all the other physicians involved.
Yeah, and the pharmacy as well.
And the pharmacist
case
as
management,
well.
etc. Yeah, it's all the subspecialists that are necessary, the cardiologists, neurologists, orthopedic surgeons.
Exactly.
Again, you're like the quarterback of the team as well.
Right, exactly. Yeah, you're trying to move the process forward and, and be that leader for the entire team. Mm-hmm.
So let's talk a little bit about who benefits from a hospitalist. Obviously, it's the patients, but you're often there long shifts. Correct me if I'm wrong. I'm not there.
That's right. Yeah, that's right. So we do 12-hour shifts usually. So you have that, day doctor and a night doctor. The night doctor is usually called the nocturnist, and that way, you're there for your patients 24/7. If there's an emergency, we can be there within minutes, for prompt assessment and treatment. So our patients are, first and foremost who benefit, and also primary care physicians in the area, because like I said, they're not always available. They're seeing patients in their clinic and having appointments and whatnot, so it's hard for them to come see their patients in the hospital. So we're really like their eyes and ears in the hospital, and for their acutely sick patients, and they entrust their patients' health for us, and we try to give them an outline of what happened during the hospital course with a discharge summary. If we know the primary care physician, if the patient does tell us that, then we can fax that to the primary doctor so they have an idea of what happened during the hospital stay. Is there any labs or follow-up that are needed, or any scans that need to be monitored? So that's who really benefits as well. And the hospital system too. We're in an era where healthcare costs are very closely monitored. So, to provide the most efficient healthcare in a timely manner, reduce that hospital stay, length of stay, and recurrent admissions is our goal.
Yeah, you're the communication, the connection, and providing efficient care. Exactly. Wow, I bet you're on your feet all 12 hours.
Yeah.
And it
you
must
need good shoes.
Yeah, and when you're not, you're trying to get those community physicians on the phone or email, because I know that can be tough as well.
Right.
We're here with Dr. Monica Shah, hospital medicine hospitalist with Broward Health Imperial Point and Broward Health Coral Springs as well. Why did you decide to become a hospitalist?
Yeah, so I'm sure a lot of people in this chair always answer, I wanted to be a doctor ever since I was little, and that's very true for me. My father's a physician, wanted to follow in his footsteps, so applied to medical school, and I was just so intrigued by the different diseases and how they all integrate together, and different specialties. And so internal medicine really encompassed all of that for me, so that was a great passion of mine. And then as soon as I went into residency, most of your time is on the floors in the wards, seeing patients that are acutely sick getting better before your eyes. So that's the way I love to practice medicine, is that instantaneous results, and discussing with different consultants right there in the hospital. So I love it every day.
Yeah, I'm a big fan of internal medicine. Internists have helped me out so much, and they really tackle everything. So I'm sure Broward Health is so happy to have you as a hospitalist, but someday you're going to be a great internist in the community. I know it as well. You manage, as an internist, internal medicine, you manage a lot of specific diseases as well.
Oh, yeah, absolutely. I mean, you name it, we see it. So, whether it's diabetes, hypertensive emergencies, stroke management, heart attacks, we see it all, kidney failure, infectious processes, all of it. So, and we, believe it or not, we see a lot of rheumatologic conditions, which at times can be the most complex cases. Whether it be a lupus flare or some kind of autoimmune mystery that, it would be really beneficial to have a rheumatologist on the case. So I'm really grateful that my husband is a rheumatologist and is, credentialed at 5 hospitals within the community. So that's been very beneficial to have him on board, whether it's for his own patients or, others in the community. And he's able to do that, which a lot of rheumatologists are not, because, it's such an outpatient setting for that field.
Yeah, that is great. 5 hospitals, Dr. Shah. That's amazing. Broward and Palm Beach County?
Exactly.
That is, and West Boca Medical Center right here in Boca Raton. Thanks for mentioning that. We got a couple more questions. We're ripping through them, but that's good. We hear that you work 7 days, 12 hours in a row, 7 days straight?
Yeah, I know.
You're still doing
crazy. Still doing it.
It's like residency stuff, right?
Yeah. I mean, it's nice in a way. Of course, it is a lot during that week, but it's the best for that continuity for patients. And it's actually the most beneficial for their health, because if I'm the physician that's seeing you right when you come in, and I'm seeing you every day until discharge, it really, helps and provides the best outcomes. An average patient stay in the hospital is about 2 to 5 days. And of course, that varies depending on disease severity and whatnot. But we try to capture that with doing those 7 days in a row.
Well, thank you for that service. I did not know that. That is amazing. And that is just outstanding. Lastly, with such a busy schedule, what are your personal interests and hobbies?
Oh, yeah. Of course, we have our 4-year-old and almost 2-year-old, so our hands are pretty full. But when I do get some free time, I love to travel. My parents are out in Chicago, so I try to go back, visit them, travel, when we can to all across the world. That's always, more of an interest of mine rather than what we can do right now with our kids and the busy schedule and the new practice that my husband has. But that's, of course, a passion. And then trying out new recipes. I've been, really looking up. We were talking about, we're vegetarian, so trying out new things, getting our kids interested in eating healthy. We got to practice what we preach. So got to do that. And then, lately I've been really, wanting to get involved more. And so the women in medicine and advocating for that. Just yesterday, February 3rd, was Dr. Elizabeth Blackwell's birthday. So that marked National Women's Physicians Day. So for that, I want to, have that, as an example for my daughters and the future generation.
Thank you so much for mentioning that. That's so important. That is great. I want to thank both of you for coming along. I mean,
Thank
you
you.
have young ones at home. It's, in the evening, but it worked out good, and such great information. And yeah, I wore my tie for my little one, Daisy. That's my Daisy tie. But also, my mom's going to love this program. She's from Chicago, so thanks for mentioning it.
Okay.
Yeah, the Austin area. That was years ago. But so last question, Cubs or White Sox?
Oh, Cubs all the way.
Okay,
I'm a
Mom.
North Side girl.
You're going to like that, the North Side.
Yeah.
So thank you so much.
Thank you for
both
having
Dr. Jgar
us.
Shah and Dr. Monica Shah from Broward Health. We'll see you next time on the You and Your Doctors Show.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthy